here's an example of what we did. Again, we went to clinicaltrials.gov. We pulled a colorectal cancer study, and then we looked at the inclusion-exclusion criteria and leveraged one of our products to actually create a cohort that is representative, as closely representative as possible to that trial's inclusion-exclusion criteria. And we saw strategically how each inclusion-exclusion criteria impacted that available population of patients who've been diagnosed with metastatic colorectal cancer. What we notice is that relative to the total population of patients diagnosed with metastatic colorectal cancer, there's a 69% reduction relative to that top line value versus the cohort of interest. 69% reduction in the available Black Americans in that final cohort, as opposed to a 63% reduction in the white American community. So again, out the gate, this can begin to inform whether there are specific inclusion criteria that a company might want to further interrogate, but at least setting them up for success out the gate to understand what the challenges might be specifically for recruiting a population that is disproportionately impacted by that specific disease. And the last point here too is we actually sequentially looked at each inclusion-exclusion criteria. We determined that, at least for the way this cohort was designed, there was definitely one criteria that really drove a lot of that differentiation, and it was related to the brain mets criteria, where we saw the most disparity between the African American Black population versus the white American population within that specific cohort. So again, companies better informed to decide as to whether they can proceed with that inclusion-exclusion criteria, or if there's an opportunity to switch it out, to change it, and if not, understand how to move forward to enable the trial to be successful in light of that.